Thanks so much for having me here today. I always appreciate the opportunity to talk about our youth because they're such a great population to work with. So, so this topic is a little dry to some, but like to some nerdy people like me, I love it. So, as Summer mentioned, my name is Colleen Fox. I'm the Director of Adolescent Services at Hinamauka, and I've been working with youth and families for about 25 years. And our youth-based services, which at Hinamauka we refer to as the Teen Care Program, includes both prevention and treatment programs. So just to say just a little bit about that. In our prevention programs, we partner with schools to provide evidence-based prevention and education. We participate in community coalitions to try to influence more community types of change and influence some of the policies that influence our youth and our families. And we also disseminate information about healthy living and the risks of substance misuse. We do that through presentations, and we also do it through our social media campaign. We also provide substance use disorder treatment to youth in Oahu and in Kauai. Our school-based treatment settings, the clients that we work with are primarily self or peer referred. They can be referred by the teachers also and other folks. But while youth receiving substance use disorder treatment through our community-based offices in Kaneohe and Waipahu, they're primarily referred by parents and school administrators and probation officers and sometimes professionals. And then the other service that we provide is we provide mental health services for youth through our intensive in-home services. Our therapists work with youth experiencing behavioral or emotional challenges and their families. And of course, youth are referred to our intensive in-home program by the Family Guidance Centers. That's a CAMHD program. So today, our objectives are to understand consent and confidentiality as they apply to minors who are seeking healthcare services. And I have no conflicts of interest to disclose. Okay. So the information that I'm sharing today is part of a guide that we created about consent laws in Hawaii and confidentiality. It was modeled after sections of this California guide. It was called Understanding Confidentiality and Minor Consent in California, which was published in 2010 by the Adolescent Health Working Group and the California Adolescent Health Collaborative. So this Hawaii guide that we created was developed by our former practicum student, Carissa DeWeird, and myself. We worked together on this, and we had wonderful help reviewing the document from Dina Sheck, who is the legal director of the Medical Legal Partnership for Children in Hawaii at the law school, and law student Rebecca Grennan. So that was great to have their expertise. And we developed the guide in order to help our youth serving staff in making referrals and helping youth to access services in the community. The information I am sharing today does not constitute legal advice. So I'm going to start by talking about informed consent and the concept of it. Informed consent is the fundamental right of a person who is being offered medical or behavioral health services. It's the responsibility of the health professional to provide information about the benefits, the risks, and alternatives to any recommended treatment. And so this process of informed consent ensures that patients can make an informed decision about their care. And that's a process that we all are familiar with. And for some services, minors of a certain age have been deemed to have the legal capacity to make those health decisions on their own once they've been informed about the risks and benefits of the recommended treatment. And so I think that's always a really important thing to keep in mind about informed consent, that who has the authority to consent. So sometimes it's the adult, sometimes it's the adolescent, right? Sometimes it might be a guardian of a person who's not capable of making that consent. Do they have the information, the knowledge to make that consent? Do they understand what you're telling them about that? What services are going to be made available? Are they choosing? Is it voluntary? Are they choosing to make that consent on their own, or is someone requiring them to make that consent in some way? Informed consent involves being voluntary. And are we documenting it? And then the concept of confidentiality, again, should be something that we're all familiar with. People have kind of slightly different understandings of confidentiality, and depends on the, as we're going to talk about today, it really depends on what structure is surrounding that confidentiality. So it refers to a set of rules or ethics that limit access to the information a patient has revealed to their healthcare provider. So generally, confidentiality means that the provider must obtain permission from the patient to make a disclosure to a third party. So though a minor may have the right to consent to a treatment or a service, it doesn't necessarily mean that that service is confidential, or that participation in services cannot be redisclosed to the patient's parents or guardian. So, when we kind of started doing this too, even though I guess implicitly I did understand consent confidentiality, but really doing this made me think much more deeply about how different those concepts are, and how there's a lot of, especially in my field of substance use disorder treatment, where our confidentiality is so strong, there's an assumption about how that information, if something's confidential, who can access that information, which I found the more I looked into this, that really is not always clear, and is something that we should really understand in order to help the youth that we're serving make choices about when they want to protect their privacy. Okay, so I'm going to start by I'm going to be talking about a variety of healthcare services that youth are able to access. And I'm going to start by talking about drug and alcohol treatment, which is the area that I am the most familiar with too. And so substance use disorder treatment has the strictest confidentiality requirements of all of the healthcare services that I'm going to be talking about today. So that's why I thought it'd be useful to start with it too. And that a minor's consent to substance use disorder treatment here in Hawaii is determined by state law, whereas confidentiality is governed by federal law. So I talk a little bit about that. So according to Hawaii law, minors can consent to substance use disorder treatment without parental or guardian consent. The Hawaii law doesn't list a specific age, but is understood to be the age of reason. So when the youth has a developmental ability to make an informed consent. State law says that the youth who is consenting to treatment is financially responsible, not the parent. So that's the state law. And that is the consent part. And then the thing with substance use disorder treatment is governed by HIPAA, but it's also, more importantly, is governed by CFR 42 Part 2. So that's the relevant federal law that has to do with confidentiality. Which I'll refer to as Part 2. So Part 2 regulates any drug or alcohol program that's federally assisted. So meaning it's authorized, certified, licensed, or funded in whole or part by any department of the federal government, including being tax exempt or registering with Medicare or receiving federal block grant funds. So for instance, for Hinamauka, we meet all three of those things. So we are a federally assisted program. Under Part 2, written consent by the minor who receives the substance use disorder treatment is required to release any information or involvement with treatment, or even acknowledging that they're in treatment, including to parents or guardians. So CFR 42, it means that in order to acknowledge that the youth is in service or work with families, we need a consent that is signed by the youth, and the youth is the one who consents for family involvement. And a general authorizations for the release of medical or other information is not sufficient for this purpose. So it has to be a specific release of information that specifically references CFR 42 Part 2. And then when the information is revealed with a consent, so we have a written consent and we do disclose information, patient information, that information cannot be redisclosed to another party. So this creates stronger privacy protections than HIPAA alone. So limitations on redisclosure is a key aspect of understanding the confidentiality around substance use disorder treatment, concept of redisclosure. So if an example of this is if a client allows me to disclose, if a client signs a consent that would allow me to disclose information to, say, a probation officer, that she's in treatment, that probation officer cannot redisclose that the youth is in treatment to, say, a care coordinator who's also working with the youth. And like, for instance, in our schools, we have a consent to release information to schools around their attendance. But that doesn't mean that a teacher or counselor in the school can then release that information to the parent. So that redisclosure piece is really an important aspect of substance use disorder treatment. And these laws were created because there's a lot of stigma around substance use disorders and discrimination, and to reduce potential discrimination. People have a lot of opinions about folks with substance use disorders, and so it really helps people to access treatment services. So Part 2 has been modified in recent years a couple times. One change recently, for instance, would allow a written consent to list an agency or an organization instead of just a specific individual. So in the past, if someone's probation officer changed, we would need to get another consent for the new probation officer before we could talk to or even acknowledge that they're in treatment with that PO. But now you can put judiciary, and that will include other probation officers. So you can put an agency as well as an individual. And then SAMHSA is currently accepting comments on proposed changes to Part 2, which could impact significant portions of the law, including consent, redisclosure, and court orders. And the ability to consent and the strictness of the confidentiality has really enabled a lot of kids to come forward to get drug and alcohol treatment services that would not have done so otherwise. One of the things that the data kind of shows us is that kids are, adults are more nervous about their substance use disorders and more reluctant to share about their mental health disorders, whereas kids are more open about mental health challenges that they're having, but are more reluctant to share that they're having problems with drugs or alcohol. So it's really important that we provide safety so that they can come forward to get help before the problem really worsens or they have much more serious consequences. And I'm going to talk about the mental health services for adolescents. So a minor who is 14 years or older may consent to outpatient mental health services without knowledge or participation of parents if a licensed therapist determines that the minor is mature enough to participate intelligently in the mental health treatment and that involving parents would be inappropriate. So one thing to keep in mind with the insurance is therapists cannot bill for out-of-pocket payments, co-payments, co-insurance, or deductibles. And upon receiving notification from the therapist, the health plan cannot disclose to the minor's parents or legal guardians that the minor initiated mental health services that they were rendered. So, this law is relatively new. So this law came into effect in the last 5 or 7 years, and so there's been changes that keep being made to improve it too. One other piece to keep in mind is that a minor cannot cancel a parent or legal guardian's consent given on the minor's behalf, nor can parents or legal guardians cancel the minor's consent. So, and one thing that I think when you're working with kids to keep in mind with this too is that the provider does not need the minor's consent to tell the parents, written or otherwise. So this law really gives the provider the decision making about whether they should involve parents or not. And there's no process if the therapist is working with the youth initially saying, yeah, we can work without your families. I understand that you don't want to come forward otherwise. We can work together. And if that provider decides, yeah, I'm going to involve the family, there's actually no process to make that shift. Like the therapist can just tell the parents. There's nothing has to be signed, nothing has to occur. So that's a little bit how that works. And then I want to talk a little bit how substance use disorder treatment and mental health services are different. So sometimes we kind of group these in together, and I want to kind of talk a little bit about how when it comes to consent and confidentiality, how they're different. And so with substance use disorder, a client signs a consent to share information with you. You can't further redisclose that information with others. So keep that in mind too if you're working with folks in treatment, that if you're at a IEP meeting, you can't, just because information's been disclosed to you doesn't mean that you can disclose that to other folks, right? The substance abuse counselor will know who has who the information can be released to, and they can release that information. So mental health services doesn't have the redisclosure limitation. HIPAA privacy statements specifically state that authorization may be subject to redisclosure and no longer protected by the rule. With substance use disorder, the youth consents to family involvement, and mental health services, the provider decides whether or not to involve the parents, even when the services are youth initiated. And in order to access substance use disorder records for prosecution or investigation, there needs to be a special court hearing to justify what information is needed and why, whereas mental health has a traditional court order is sufficient. And age restrictions for consent to access substance use disorder treatment services, they're based on when the youth has the cognitive ability to provide informed consent, and with mental health services, it's at age 14. Okay. So the next area I'm going to mention is emergency shelter. So with an emergency shelter, so if a youth is houseless, or they're running away and they're accessing an emergency shelter. So in that case, the providers will attempt, the way the law is written, providers will attempt to contact parents or guardians unless they believe the minor will be in harm or danger if they went home. And there are, for instance, one agency that works with youth is RISE. They operate 2 emergency housing shelters and 3 housing programs for youth ages 14 to 24. Okay, and now I'm going to talk about contraception. So accessibility and age restrictions for purchasing emergency contraception are governed by FDA rules regarding specific brands. So one thing, if you're working with kids, it's kind of useful to know, be able to help advise them in this area too, if this is some information they're looking for. So Plan B, one-step emergency contraception is available over the counter with no age restriction. Other emergency contraception pills are available over the counter, such as My Way or Next Choice One Dose. But unless they have a prescription, the minor is going to need ID showing that they're 17 or older. And then some emergency contraception pills like Ella require a prescription by a pharmacist or another medical provider. And then in terms of condoms, a person can buy condoms without prescription or parental permission. One thing to keep in mind with this is that there's no law that guarantees the right to access emergency contraceptions or condoms in a retail or pharmacy setting. So larger chains are pretty good. Like even if you call them to kind of follow through to see like what's going to happen if a youth goes to access, wants to buy a condom. With larger chains, they're usually only going to ask for an ID or a prescription if when they're checking it out, the requirement comes up on their, on their computer. And so then when they check the person out, store workers or pharmacists could potentially inform a parent, but as they're not restricted from doing so. So just always keep that in mind, especially people who work especially with our, working with youth in rural areas, that's going to be important to keep in mind.
Can I ask a few questions? I've been falling down on my job here. So back to the probation officers.
Yeah.
Let's see, do the confidentiality and consent requirements apply to them?
Yes, that's excellent. I'm glad. Thank you for asking that. I didn't say that. So that's a really good point. So if you are working with a youth who is receiving substance abuse treatment services from another agency, say from Hinamauka, and we're working with you, and we get a consent from the youth to share information with you, say you're a therapist, and we get information to share information with you, you are bound by CFR 42 Part 2. So great question.
Okay. And then next question. If youth are deemed financially responsible, how do treating facilities ensure that they get enough remuneration to remain in business when consent is given by youth?
Great question. So yeah, that's an interesting piece about like who's responsible when for the financial part. And so, and I did think that law in the for the mental health law was good, that they're not asking people to do co-pays, but it does present issues for the providing therapists. So one thing I will say with substance abuse treatment is a lot of substance abuse treatment services still has some state funding attached to it that kind of helps a little bit with that insurance piece. With the mental health programs, I would say it's a little bit more challenging unless you are working with, say, CAMHD clients. And one thing I will say, this law is terrific. This law exists, but putting it into practice is a little bit more challenging. And so, you know, one part is like, for instance, if you have like a Quest client that you know, there's no copay anyhow, it's a little bit different. But if you're working with a commercial client where the copay is going to be more significant, then it could come at a greater loss. And again, with the substance use disorder programs, it's less of an issue, but with the mental health, it's a little bit more of an issue. And so that is a challenge. I don't have a good answer for that, but I hope that, yeah.
I find it ironic that insurance companies and the government are quick to forgive copays, which go actually to the provider. So really, it's not their right to forgive or to, you know, eliminate copays because it's not their money. But anyway, a couple other payment questions.
Yeah.
So the minor may or may not be liable for payment of services, right? They are, right? If they don't, well, okay, let me ask you the next one too.
Well, for the substance use disorder treatment, they are, that's an old law. Keep in mind that law has been in the books for a long, long time. That's been for, you know, 25, 30 years, that law has been in place. So in that one, the youth is responsible, but again, they're kind of protected because we have a lot of state funding to help support substance use disorder treatment, and we provide it in the schools, and it's really accessible. But for the mental health law, who is financially viable too is that, yeah, you can't hold anyone sort of liable for payment in that situation. If the youth is coming to you for services and you don't get paid by whoever it might be, then you can't really hold anybody accountable for that. That is an interesting piece.
Oh, the next question kind of goes to that. If the minor uses their insurance coverage for payment for services, that gets sent to their parents, right?
Well, that's the piece where it's really important. And actually, I have to say, CAMHD did a great job working with MedQuest and the state to try to make this work a little bit. How it's going to work in real practice is another issue. But what should happen is that the therapists, before they bill payments, they should be reaching out to the insurance company and saying that this is a youth-initiated treatment service, and that the records in the parents should not have access to the records of these services, because that is an issue. That's a big issue.
As a provider, you can't be sure that will happen.
So in theory, that's what's supposed to happen. You absolutely can't be sure that's going to happen. I think they're trying their best, and it's not like they work really with MedQuest, so it's kind of hard to know what these commercial insurance companies are going to do when that happens too. And it's one of these systems that hasn't been tested a lot yet. It's good in theory, but practice, it could be really challenging.
Ooh, we got more questions on this, and then we're going back to the contraceptives. What about drug screening results when doing an annual exam? If someone seeks mental health once for substance use disorder, then any mental health service received after that initial discovery or treatment is held to the CFR confidentiality rule. Okay, so two questions. If somebody gets drug screening annually, I guess it's
so what you want to keep in mind is CFR 42 Part 2 applies when you're providing substance abuse treatment, or like if you are getting information from that provider about that person's substance abuse treatment. So getting a drug screen in other settings, like even like, parents ask their doctors to drug screen their kids, agencies that are providing mental health services. They might work with families to teach them about drug testing. They might do drug testing. Obviously, our court and kids are getting drug tested regularly. So all of that, if it's, not outside of it's, it's not part of substance abuse treatment, then it doesn't apply. Part 2 doesn't apply. Now, if like for drug testing does apply, like for instance, in our setting where we're doing substance use disorder treatment. So when we do drug testing at our Waipahu or Kaneohe clinic, we have a consent from the youth that allows us to release that information to the parent and to the referral source, usually the probation officer or whoever the referral might be like a private school. But we wouldn't be able to release information about the drug testing if we didn't have a consent. But it really only applies to people, specifically drug treatment programs.
Got it. Okay, back to sex. Are female OTC contraceptives treated the same as condoms? And I think back in my teens, they were all in the shelves there. And I think the morning after pill is there too, isn't it?
I honestly, I think some of that stuff is behind the counter because some of it, the Plan B, I think is usually in the pharmacy section.
So you have to ask for it.
Yeah, I don't think it's right in front. Like, I don't think it's that easily accessible. I think the pregnancy tests are more accessible, but the Plan B, I think, is generally behind the pharmacy. But I am not certain about that. Yeah, those are good questions. That's a really excellent to know about before you advise a kid to help them. Yeah. What is this going to look like? Yeah. So
Renata says Plan B is out on the shelves but locked up. Well, that's almost as embarrassing or more maybe than asking the pharmacist. Alyssa says that Kapiolani has an OBGYN clinic specifically for teens. We offer free condoms and confidential teen services and work with insurance for billing. And there's the link in the chat.
Great. Nice.
Let's see. Okay, so 2 more questions, sorry. If a minor over age 14 is in family therapy for mental health and requests confidentiality on a particular topic, not safety related, can the therapist disclose to the parents what was discussed? Ooh.
What I would say though about the mental health laws, it's really therapist driven. The youth doesn't have nearly as many rights as they do with substance use disorder treatment. So I would say that there's like the general what's the best practice, and so like you don't necessarily want to reveal everything, but legally they could share information with parents in mental health services, and there won't be any there's no problem with that. There's no legal issue because the parent can be the one that actually is the one that gives consent for kids accessing services. And when it's the youth who is giving consent to access services, there's nothing really in the law that protects the youth from that says a therapist can't share things with parents.
Interesting.
So I don't think that's a concern. That there's like the best practice. I mean, the best practice, we don't like just share everything for no reason. But legally, the law doesn't read where it's going to be an issue for the therapist if they share things with the parent.
Okay. Is there a time limit to how long the consent lasts? Like if someone seeks mental health services once for substance use, then are any mental health services received after that initial discovery or treatment held to the same confidential? Oh wait, I already asked that one, didn't I? No.
Well,
yeah.
In general, mental health, in general, consents they're going to be time limited. So generally, like they wouldn't be over a year unless there's a specific reason, like you're doing a follow-up that's going to be a year and a half out, or like for instance, we do our consents 1 year after discharge because we do follow-up. And so most of the case, that's going to be the case. But so that means that the consent expires after a certain amount of time. But that the information is still always going to fall under the record. Information is still going to fall under the CFR 42 Part 2 for substance abuse treatment.
Okay, and if they're harming themselves, if the youth is harming themselves, it's no longer confidential, right?
So that's kind of an interesting issue. So actually, I had a big conversation with the Legal Action Center, because when you're taught about ethics and confidentiality, people always are like, oh, because of the TerraSoft case, right? They always sort of say, oh, except for in case of emergency, or, duty to harm issues, right? Duty to harm, or duty to warn, duty to warn issues that we can report. So what I would say is, I think it's a lot less of an issue with HIPAA. So with mental health, I think it's a lot less of an issue. And honestly, I don't remember off the top of my head. I don't think HIPAA specifically says anything about duty to warn issues. But it's not so restrictive in general anyhow. With CFR 42, there's actually their only exception is for child abuse. There is no exception written into the law for homicide or suicidal ideation. So that doesn't mean that agencies, so I think that's something, the way that we talk about it in substance use disorder treatment is to kind of think about it is when there's a duty to warn situations, we might as an agency choose to break confidentiality in order to protect the client. So that's kind of where the TerraSoft precedent of duty to warn kind of comes into play, but you're still actually choosing to break confidentiality. So there's lots of ways that you can do things without necessarily breaking confidentiality. There's lots of ways we actually changed our consents recently because of that too, where our consents with the school and the parents, we always now include the reference to those kinds of potential issues so that we are kind of covered if they do come up. But agencies choose to break confidentiality all the time. And not all the time, that's the wrong way to say it, but in certain situations, right? So we might have situations where we don't have a consent, but we've had kids who might have, like, say, a kill list or something, right? So we are going to break confidentiality and we're going to get involve other folks to get help for that person. So, but that's something a therapist should decide that by themselves. They should work with their agency, and that way you're better protected that way too.
Okay, and then 2 questions came in. Hopefully your PowerPoint and a recording will be available on the ECHO website afterwards. And then someone asked about physical exams. I think the not being responsible for payment was just for mental health treatment, right? It wasn't if
Correct.
a minor has a physical exam and then, so it's not just for everything, it's just for the mental health treatment. Okay. And then, okay, we have a clarification on emergency shelter services. The minor can be interviewed without the parent or legal guardian present. If yes, is there measures that need to be taken?
So I'm sorry, is that a question or a statement? Sorry.
Yeah. Sorry, if a minor comes into a shelter, they can be interviewed without the parent or legal guardian present, and then you don't have to take any measures to contact the parent unless they want you to. Is that correct?
Well, what I would say, the way the law, the HRS reads, is that they will attempt to reach the parent unless they feel that there is risk of harm to the youth. So they might decide that, at this point it would be whatever reason, they might decide that it's not appropriate to try to reach out to the parent. But the law says that they will unless they think there's a risk.
Got it. Okay, back to sex now.
All right. Okay, so I'm going to move to. So now we're going to talk a little about family planning. So there's no age requirement or need for parent permission to buy a pregnancy test. And in retail settings, just keep in mind there could be similar issues as discussed, the same thing with emergency contraception or condoms. So if youth is seeking privacy in a retail setting, you're going to also want to consider things like payment type. Are they using cash? Are they using a credit card parent has access to? And to avoid the collection of personal information, like don't put in your phone number to get that discount, right? Because that information, you don't know where that information goes. With family planning, starting at age 14, a minor can consent to family planning services. And family planning services are not inherently confidential for minors, even when the youth is old enough to consent. So the way that the the law reads is that the healthcare provider may inform a minor's parent or guardian about the services provided, but they're not required to. And then in terms of to test for sexually transmitted infections, starting at age 14, the minor can consent to STI testing and treatment. The exception for this is hepatitis C testing, which in order to consent, you still have to be 18 to consent to hep C testing. And then when it comes to abortion, a minor who is 14 or older can consent to an abortion. And Hawaii allows for abortions up to the point of viability, which is usually 24 to 26 weeks. So in Hawaii, abortion for minors really seems to rely on case law rather than explicit wording around the age that minors can consent to an abortion. And so one thing to keep in mind is with a Dobbs decision, the lack of explicit protection could put minors' access to abortion at risk. Okay, and now I'm going to talk about primary medical care and services. And there's a pretty expansive law that's been around for a while about this. So, I'm going to talk about parental notification in general too. So minors 14 and older don't need parental consent to get family planning and pregnancy services, to get STI and HIV testing and treatment, or to get an abortion. However, medical professionals aren't required to keep the minor's information confidential from a parent or guardian. So if you're working with minors who are concerned about their healthcare information being revealed to family members, they can access organizations that spell out what confidentiality standards they follow, such as Planned Parenthood or Department of Health funded family planning clinics, or as mentioned earlier, Kapiolani, the Kapiolani program. And family planning clinics that receive Title X funding, federal funding, must maintain minor confidentiality. So in 2022, a variety of Hawaii clinics became sub-grantees of Title X funding after Hawaii was recognized as one of the locations where there was a dire need for Title X family planning services. So knowing if a client receives Title X funds can help to ensure that you're providing a confidential referral. So give clients options and be aware of what clinics won't provide certain services and what clinics keep services confidential. So we always, tell our counselors too, you are influencing their choice by who you send them to. So, send them to a provider that will give them all the choices so that you're not allowing your values to influence your counseling. And now with primary medical care and services, a minor can consent to receive primary medical care if they are without support. So not under the care, supervision, or control of a parent, custodian, or legal guardian. And this law was intended to provide access to outpatient medical services for minors whose circumstances prevent parental consents, like including kids who are homeless, those who are running away from abuse, and Pacific Island minors, right? So folks who come in, especially folks who come in through COFA, the Compact of Free Association, that come to Hawaii on their own. And surgery and other invasive procedures are excluded. And this is a case too where the licensed healthcare professional must notify the plan prior to submitting the claim. And this is one that I don't know where the payment liability falls. I'm assuming it, so that is an area I'm not sure about. I should go back and check that. All right. And then I just have a couple more slides. So I'm going to switch here and talk about sexual consent. So sexual consent is, of course, totally different than informed consent. But it's something that's really important to understand when you work with kids. So that's why I'm going to mention this. So in Hawaii, we have the concept of the age of consent, and that refers to the legally defined age when a person is deemed mature enough to engage in sexual activity. So in Hawaii, at 16 years of age, a person can legally consent to sexual activity with another person who has also reached the age of consent, at least 16. And then people who are 14, under the age of 14, can't consent to sexual activity under any circumstances. But there's this sort of like gap provision for the kids who are 14 and 15, understanding that that some teens can consent to sexual activity with another person who is less than 5 years older. So kids that are 14 or 15 can consent to sexual activity with a person who is less than 5 years older. And it kind of recognizes that some teens can be in a consensual sexual relationship with another, even if they are younger than 16. So here's a little graph to kind of help you understand. So this graph helps to clarify, but you really need to know the birth dates of both people to accurately gauge the difference because it's less than 5 years. So an example would be that under Hawaii law, someone who just turned 15 years old can't consent to sexual activity with a person who is about to turn 21 years old. However, it would not be prohibited for a person who just turned 15 to engage in consensual sexual activity with someone who is 17, 18, or 19 years old. So let's keep that in mind there. And then
I'm going to tell them that.
Yeah. Well, at least so they know, and they know the risks that they're getting into, and it's important. It's an issue that comes up so much when you work with kids too.
One thing here, interesting, we got the question from Guam, but are minors who are without support eligible for state aid in Hawaii? And I believe they are.
That I don't have a question, and I know COFA members are, certainly COFA, but I don't know in general if that's the case. So I know if someone else knows that answer.
Anybody know if minors without support are eligible? I don't think we turn minors away, but could they get Medicaid? That's a question.
Yeah, I don't know, because of that whole eligibility process and like the application process. That's the challenge with these things too. Even if you could, can they access those things? I definitely think for COFA they can, they do, but I don't know about
Jennifer says CPS signs them up. Renata asked if they're emancipated. So I think we would probably be one of the more lenient states to take care of them. Anyway, sorry, go ahead. Back to sex again. Back to sex.
Good questions there. And then here's one thing I just want to say too, this is a caveat that only applies to substance use disorder counselors, but substance use disorder counselors can't disclose reported sexual activity or sexual assault without a consent from the client unless the sexual activity constitutes child abuse. And that's because CFR 42 Part 2 has an exception for reporting child abuse, and child abuse includes physical or psychological harm by a family or household member or sex trafficking of a minor. But with CFR 42 Part 2, you can't just report something because it's illegal, but it does provide an exception when it comes to child abuse. And then I just wanted to mention here sexting, because it's such a common thing nowadays too. So to be aware of the issues with this is that, sexting is sending a sexually explicit image via messaging or other means like through mobile phone, computer, or other devices capable of electronic data transmission or distribution. And it's becoming increasingly common, and most kids don't even realize that it's a crime. And so sexting falls under child pornography laws, sexting with a minor, so which state that pictures of a person under 18 engaged in sexually explicit conduct is a crime. It's a felony for adults to sext with a minor, and it's a petty misdemeanor for minors to sext with other minors. So, and this is my final slide here. This is a graph, and also too, I have a guide that we put together that I think will be uploaded onto the page where you folks can access it too. But the guide has more detailed about all the information that I went through today. And actually it lists the laws that I refer to too, so that you can always look that up yourself too. And the graph is really just a summary of this information that we described. And the big takeaway that I would ask you folks to think about too is just because a minor can consent to a health service doesn't mean it's confidential. And when you're working with youth, really help them to understand what questions they can ask their providers around confidentiality, right? So they can ask questions about, can I get services at your, so if they want to call, if they want to find out if those services are private, kind of coach them to be like, what do you need to call and ask? Can I get services at your office without my parents' permission? If I made an appointment and received services at your clinic, will you tell my parents or anyone else? Do my parents have access to my record? And will my parents see the bill? So these are all kind of things that you can help to work with the youth that you're working with that are seeking to protect their privacy. So thanks for all that you do to help our youth access healthcare services. Any, yes. And that's all I have for my slides.
Oh, no, this is great. Can you go back to the sexting slide for a second? Renata
Of
wants
course.
oh, and by the way, in the chat was a link to the Title 10 clinics. So these
Oh,
are the
great.
ones where you know that it's going to be confidential. And then, let's see. On the next slide, I had questions. So what questions do folks have? We've had lots of questions today, which is exciting. Let's see here. So I was talking to students at a high school the other day, and one of the questions was, how old does somebody have to be before they can be seen without their parent? And I was out of date and I thought it was 16 and I was wrong. So 14, but then there were other permutations to that question. So let's see if somebody is 13 and wants to be seen. Let's see, minors of any age can go to emergency shelter. And let's see, I guess any age they can go to the healthcare provider. Will the information be shared with their parents? How about a 14-year-old goes in for something that is not a sexually transmitted disease, but doesn't want their parents to know? I guess they could just ask. If it's primary care, they could just ask, but then they're going to be probably financially at risk for that.
Right. I think the key with most of these issues, like especially all the health, the like physical health related ones, particularly, right? The family planning, the medical care kind of thing too, the pregnancy services, is they don't have to tell the parents. So doctors don't have to tell the parents. The kids are 14 or older, they can provide family planning services, pregnancy, counsel them, give them a pregnancy test. They can do all that stuff in their office without, and there's no obligation to tell the parents. But there's no, there's nothing that protects the youth to say like, oh, they're not going to tell your parents. So, that's where they would really need to ask questions. Or again, to like a person who's working with a kid could always call the medical practice and say, do you folks have a policy? And again, the best thing is that they can go to a Title 10 clinic or, go to Planned Parenthood, but like for some services, it isn't reasonable, right? You're in a rural area, you may not have access, you might be seeing your doctor anyways. And so, they can always ask, like, what kinds of things will you tell my parent about if I bring them up, and see what the doctor says. And so that's one of these tricky things, is there's nothing that, it's really up to the healthcare provider in a lot of the cases, even though they can consent to the practice. So it's kind of interesting.
And so these family planning services, pregnancy, abortion, and STI, those, if it's at a Title 10 clinic, cannot tell the parents. Did I get that right?
That's correct. 14 or older, they cannot tell the parents. They have to protect that information. Mm-hmm.
All right. And then Renata asks, is Hawaii participating in the gradual process of having the youth take over portions of their health responsibilities, including health visits? And I haven't heard anything about that, but I'm not always in the know. Anybody know? Is that a worldwide trend or a countrywide trend?
The only thing I know related to that is I know that the legislature has been talking a lot more about, there's been like in the DOH and ledge and government, the governors, they've been talking about like more community health programs at schools. So for instance, like we do substance abuse treatment at schools, but we're not like health clinic. And like there have been schools, like I remember Mililani and Castle had like these pilot kind of health clinics where you could go in and get help with things, but they weren't staffed by a doctor or anything, but I think they had a nurse. But but there is talk about providing more community health services and clinics through the schools, but they've been talking about it a long time and it has yet to come to pass. So I don't know if it will occur. That's the only thing I would know that's related.
And Gail says she believes Hawaii only recognizes emancipation if 16 years older and is married, requires family court declaration of emancipation. Is that current?
I don't know. I'm not sure.
Okay, well, this is extremely helpful. Can military dependents use these services outside of their military benefits?
Yes, absolutely. And that's a big thing when you work with, when you work with military dependents, you realize they are really nervous about getting services on base or through their insurance, because their medical professionals are going to be much stricter about involving the families, because of course military families face a lot of things that the rest of us don't, and the fact that their careers can be impacted by problems that their children have. Their living situation, they be kicked off base. So they are, understandably more nervous about things that their kids get into. And so for sure, a good avenue is knowing, and the good thing is like our kids are integrated into our public and sometimes private schools in Hawaii. We don't have specific DoD schools. So that's kind of a nice thing in that they can access a lot of things through the school or through the community that they won't necessarily have to use their insurance or use a military-based provider.